Hello, Psych 101 students. Welcome to Module 7, Chapter 14, and Learning Objective 1. So in this module, we will be covering Chapters 14, Psychological Disorders, and Chapter 15, Psychological Treatments. So let's start with, Chapter 14, Psychological Disorders. And the big questions in this chapter are, what is a psychological disorder? How do people experience disorders of emotion? How do people experience disorders of thought? How do people experience disorders of the self? And what disorders affect children? In Learning Objective 1, we will be looking at disorders in general and causes of disorders, as well as categorizing and assessing disorders. This will be kind of a general overview of disorders and what kinds of causes might be relevant for various disorders, and how we categorize and assess disorders. Let's begin with the term psychopathology, which refers to sickness or disorder of the mind. That is mental illness. Psychopathology basically means mental illness. Drawing the line between normal emotions, thoughts, and behaviors and a psychological disorder can be difficult. Psychopathology is often seen as a failure of adaptation to the environment. That is, people with mental disorders aren't adjusting well to the demands of daily life. Their emotions, their thoughts, and their behaviors are disordered. Uh, when a psychological problem disrupts a person's life and causes significant distress over a long period, the problem is considered a disorder. So, for most psychological disorders or most psychopathology, this idea of causing significant distress is a very important one. If something isn't bothering the person, if they have particular unusual emotions or behaviors or thoughts, but if it doesn't cause them distress, we tend not to think of it as a disorder. Um, there are a few exceptions to that, but that's one of the main criteria that determines if something's a disorder. How much is it affecting the person? If you look at this graph here, these bars represent how relatively common a psychological disorder is for men versus women. But these are just relative rates. So, longer bars just means it's much more likely for one gender than the other, for one sex than the other. It doesn't mean that it's very a long bar doesn't mean that it's very likely within the whole population. So, for instance, the longest bar we see is for anorexia. That's because anorexia affects women much more likely than men, but anorexia is relatively uncommon in the population as a whole. So this is just kind of pointing out which ones are more, specific to one sex versus the other. So things like anorexia and PTSD are much more common in women, whereas in men you have things like alcohol and drug dependence are more common compared to women, as well as antisocial personality disorder or childhood ADHD. And you can see there's a few of them that are equally split between men and women: schizophrenia, bipolar, and OCD, or no, not OCD, obsessive compulsive personality disorder, which is slightly different than OCD, and we'll get into that later. Yeah, two. Oh, let me just see. Sorry, I think I missed a page here. Yeah. Okay. Um, so in deciding whether something is a psychopathology, it's important to consider four criteria, shown in this chart here from page 548. The first is, does it deviate from cultural norms for what is acceptable. That is, this kind of refers to behavior that is rare. It's not normal in society. Most, but not all, mental disorders tend to be uncommon. The second, um, the second criteria is it maladaptive? That means, does it interfere with functioning in everyday life? Does it cause the individual personal distress or threaten other people? Is it self-destructive? Most, but not all, disorders produce emotional pain, which qualifies as personal distress. The third criteria is sorry, that was the third. Sorry, that was the third criteria. Does it cause personal distress and is it self-destructive? Excuse me. The fourth criteria is, does it cause discomfort and concern to others? Um, Something like, for example, homosexuality. It was considered a disorder um, in the United States until 1973, and it was mainly because of societal disapproval. So sometimes something may be, considered psychopathology because it's uncomfortable to others. I know that doesn't seem like a great reason, but at times it can make sense. But thank goodness we finally declassified homosexuality in 1973 as no longer a disorder. But once again, it was because of societal disapproval that was classified as one. Each of these four criteria shown here, they each have limitations in determining if something is a psychological disorder. You can read about them in this chart here. It talks about the limitations. Once again, page 548. It's important to consider multiple criteria rather than just a single one in order to determine whether something is psychopathology or not. Because a single criteria, like because each of them does have limitations, you can never make a full determination just based on one criteria. Psychopathology is increasingly defined as occurring when thoughts, emotions, and/or behaviors cause significant distress, impair good daily functioning, or both. And those, so once again, those are a couple of the main things that are looked for. Significant, personal distress, within the person, or their daily functioning has been impaired, which could mean things like it's affecting their work or schooling, or it's affecting uh, things like I don't know, their relationships or whatnot. So it's interfering with their daily life. Um, just as an example, if you something like cross dressing, many people might say, "Oh, somebody that does cross dressing, that might be a disorder." I mean, it would not be considered a disorder unless it caused severe distress in the individual, in important areas of their functioning. If let's say some guy goes home after work every day and he likes to dress in women's clothing, I mean, big deal. He if he's not if it's not bothering him, it's not a disorder. But if he has like a compulsion and like he's really upset that he does this and it really bothers him, then it in that case it may be a disorder. So it's not always the behavior or the act itself that makes something disorder. It's what the individual doing the behavior, how they feel about it. Is it interfering with their life? Is it causing them distress? If not, then we wouldn't consider it a disorder. Okay. To fully understand any disorder, psychologists need to investigate it from four perspectives. First, we have to identify the etiology, the factors that contribute to the development of the disorder. So, um, uh, etiology is kind of like looking for causes of disorders. Secondly, we identify and assess the symptoms of the disorder to understand what is occurring. Third, you group the symptoms into meaningful categories in order to make a diagnosis. And then fourth, once you have a diagnosis, you can identify possible treatments. There are two general ways to view the causes of disorders. The first is the diathesis stress model. This proposes that a disorder may develop when an underlying vulnerability is coupled with a precipitating event. According to this model, the onset of mental disorders occurs due to both vulnerability for the disorder and the presence of stressful events. So this model, as you see in the diagram here, it illustrates how nature and nurture work together in the onset of psychological disorders. An underlying vulnerability to a psychological disorder known as a diathesis, it could be created by a genetic predisposition, or it could be created by a childhood trauma, or by both in combination. So either your genetics, which is nature, or some kind of childhood trauma, which would be considered nurture, one of those two factors or both of them together create this vulnerability, this diathesis. So because of genetics and or trauma, some people are more vulnerable to developing a psychological disorder. Then the second part of the model is that some kind of precipitating event or like highly stressful circumstance has to happen, which can act as a trigger to develop the disorder. So you could have a diathesis, but if you don't experience very stressful circumstances, then you would still have a low probability of the disorder. So this model is telling you need both. You need the initial vulnerability that gets created, and then also excessive stressful circumstances, and this creates a higher probability of a psychological disorder, the two of them together. The second way to view psychological disorders is the biopsychosocial approach. This approach states that most psychological disorders are influenced by biological, psychological, and sociocultural factors. It's all in the name: bio, psycho, social, biological, psychological, sociocultural. Let's look at each of these a little bit further, each of these three components of this model. The biological aspect of this approach focuses on how physiological factors such as brain function, neurotransmitter imbalances, and genetics contribute to psychological disorders. As an example, they show here growing recent studies show that the gut microbiome, consisting of the bacteria, fungi, and other microbes in the digestive tract, is involved with psychopathology. Research has shown that those with various psychological disorders, including depression, bipolar disorder, autism spectrum disorder, and schizophrenia, have abnormalities in their microbiome. So this is really new research that's been explored in recent years, and that that there's something in our gut, gut microbiome, like our bacteria and fungi and other microbes in our digestive tract. That this is actually seems to be involved with psychopathology, and something I'm sure was never even thought of in earlier decades, and but it is current research is showing that this is related. So this is something that's obviously in the biological approach. Going on to the psychological part of the biopsychosocial model, the psychological aspect of the approach states that thoughts, emotions, personality, and learned experiences all influence the development of psychological disorders. For example, how people think about themselves and the world around them is an important factor in many psychological disorders. So our thoughts themselves can contribute to certain disorders. And then we have social cultural factors, which include family relationships, socioeconomic status, and the cultural context. Here's a number of examples. One situational factor associated with increased psychopathology is being a college student. Increased enrollment from historically underrepresented groups may be especially likely to be stressed. Um, Possible negative effects of increased social media use has been implicated as a social cultural factor in certain disorders, and also student mental health deteriorated further during the COVID-19 pandemic. Um, Taking classes, via the internet and being isolated from others caused psychological distress for many, and thoughts of suicide also increased during the pandemic. And so these are all, things that would be considered social cultural factors. What particular situational kinds of factors or being part of a certain group or in a certain situation is a social cultural factor. And if we put them all together, we can show them in this picture here. According to the biopsychosocial approach, once again, most psychological disorders are influenced by three factors. Just to review it: biological processes such as brain function and genetics, psychological processes, including how people think and feel, and social cultural factors such as social economic status. Okay. Assessment of a person's mental functions and actions allows psychologists to categorize the individual's thoughts, emotions, and behaviors in order to make a diagnosis so that appropriate treatment can be provided. So you assess a person, and you to find out what kinds of thoughts they've been having, what kind of emotions they've been feeling, what kind of behaviors they've engaged in, and there are certain patterns that the doctor or psychologist is going to look for in order to make the diagnosis. Um, and if they can make a correct diagnosis, this would suggest what the prognosis will be. Prognosis refers to the course of the condition, like what course it's going to run and its probable outcome. This they would be able to tell you, what kind of symptoms you can expect to occur and how long certain things will last, and what are your chances of getting treatment, and things like this. So the individual and the family will know what to expect in the future. So a prognosis is obviously very important. So this is understanding the course of condition, its probable outcome is known as the prognosis. Um, Clinical psychologists use interviews, self-reports, observations, and psychological testing uh, to examine a person's mental functions and psychological health in order to diagnose a psychological disorder, and also then determine an appropriate treatment. So there are these, we have these four major methods that are used in assessments. They're not, you won't always, you wouldn't always have all four methods used for an individual, but these are the four main types of assessment methods. Let's take a further look at them. Okay. Four main assessment methods. Once again, assessing symptoms. The first step is an assessment. In an assessment is often to conduct an interview. You obviously want to know why the person has come to you, and what their main concerns are, and main symptoms and whatnot. People's self-reports can reveal a great deal. You will ask them various questions to to report on their own behaviors and their own thoughts and their own emotions. It could also give them some kind of questionnaire in order that would reveal their self-reports. You might have them do ratings of various things like what is maybe they rate from 1 to 10 what their emotions have been like during the past 2 weeks or something like that. So like there are various methods, but we want to get them to reveal as much as they can about what they've been experiencing. A psychological assessor can also gain information through observation of the client's behavior, um, sometimes just witnessing how they're acting. When they come to see you, can give you some clues as to what they're experiencing, um, how they're talking, what their body language is telling you, and things like that. Another source of information is information regarding psychopathology is psychological testing. Um, so you can see that there's one shown here in the picture. There's an example of a psychological test. This is a psychological test in order to examine mental function that they're conducting here. I can't tell you exactly how it works, but there's many different types of psychological tests that are available. For much of human history, people believed that the gods and witches or evil spirits caused psychological disorders. This is known as the demonic model. Um, Odd behaviors were thought to be the result of evil spirits inhabiting the body. So exorcisms and witch hunts were common during the Middle Ages. And then during the Renaissance, the medical the medical model saw mental illness as a physical disorder needing treatment. But treatments during this time period were no better than before. They engaged in bloodletting, which is not a good treatment for anything. And also, they used snake pits. Um, these snake pits, they would throw a patient into a snake pit in order to frighten them out of their disorder. That this, the great shock and fear that they would experience might kind of snap them out of their disorder. So, the no long, in one sense, we between the Middle Ages and the Renaissance, I mean, it improved somewhat because we didn't think about demons and evil spirits inhabiting the body anymore. We at least they determined that maybe it's something physical inside them, but they just had no idea how to go about treating things at that point. Finally, in the late 1800s and the early 1900s, excuse me, doctors like Sigmund Freud, for example, began to study psychological disorders in order to try to figure out the real causes of them. But the idea of categorizing mental disorders systematically was not officially adopted until 1952, when the American Psychiatric Association published the first edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM. And this was a huge breakthrough. Of course, it's like, let's put everything into one manual, everything that we know as far as all the different disorders we know and what we know about the symptoms of each disorder. It was like to collect all the information into one major volume that could be shared amongst doctors and psychologists and psychiatrists. Um, the the DSM contains the criteria for diagnosing mental disorders. It tells you that what a patient or a client, what kind of what kind of criteria they have to meet in order to receive a particular diagnosis. And it really was a breakthrough. I mean, it it was to gain the best knowledge that from many different experimenters and researchers and doctors and whatnot, and just combine it once again all into one central database. Now we have the internet and stuff, but back then, like, this book was your internet if you were in the business of diagnosing people. Uh, the primary purpose of the DSM is to help psychological professionals diagnose psychological disorders. In the current edition of the DSM, which is the 5th edition, it was released back in 2013. Disorders are described in terms of observable symptoms. A person must meet specific criteria to receive a particular diagnosis. The DSM has 3 major sections. An introduction with instructions for using the manual. That's the first section. The second is diagnostic criteria for all the disorders, which are grouped so that similar disorders are located near each other. And it includes decision rules for each condition. Decision rules meaning, like, it might be like, the patient needs to show 3 symptoms from column A and 2 symptoms from column B in order to receive this diagnosis. And so there's, it includes what exactly, what criteria need to be met in order to give a diagnosis. And then the final section is a guide for future psychopathology research that describes conditions not yet officially recognized as disorders. And this is a good section. It's kind of like, this is where we feel like we should be heading, and this is what we'd like. This is what we think current research should be focusing on, and it's kind of, it's a way to promote, more useful research in areas where it's needed. The DSM is a manual for assessment and diagnosis of mental disorders, but does not include information or guidelines for treatment of any disorder. So it is all about the assessment and diagnosis. Treatment information is in other places. I mean, there are multiple treatments for many different disorders, and this is why, they don't go into treatments. It would depend on what kind of psychologist is doing the treatment, or what kind of psychiatrist is doing the treatment. There are various, treatments that can be used for most disorders. Okay, let's go on here. So an alternative to categorizing a psychological disorder as present or absent is to describe the severity of the symptoms along a continuum from mild to severe. So instead of deciding if the client, for instance, is suffering from anxiety or not, which is a tough call. Like, does a person just play anxiety? Like, well, everyone's anxious sometimes. Maybe they're anxious because they came to see a psychiatrist. I mean, like, maybe they're anxious at that moment, but anxiety is something that we all experience. So it's not, you can't really say, is there anxiety or not? I mean, there's anxiety in my life, but it's not clinical. I mean, like, it's not bad. And so this idea is, to come up with a rating representing the level of anxiety present, rather than, do they have anxiety, yes or no? It's like, it's more of a rating scale. So it might be, you might have a scale with where they end up with a rating, between 0 and 10 or something like that. And this is one approach that some people have been pushing towards, rather than just saying, which symptoms are present, yes or no. And instead, we'll give everything ratings, and then we can kind of use the ratings to determine what disorders people have. Categorizing disordered thoughts and behavior. Many mental disorders may occur together, even though the DSM-5 treats them as separate disorders. For example, depression and anxiety, or depression and substance abuse. Those things go together. Depression and anxiety often co-occur, and depression and substance abuse often will be in the same person. And this is known as comorbidity. comorbidity. As this diagram shows here, psychological disorders commonly overlap. So, in the middle there, you see social anxiety disorder, and you can see that it overlaps with panic disorder and agoraphobia. It overlaps with OCD. It overlaps with body dysmorphic disorder, and this is important. So, it's the treatment might be different for somebody that just has one disorder versus a combination of two or three different disorders, and so this comorbidity idea is one of the things that they're trying to improve with the DSM, just to kind of start grouping together certain disorders, and so that clinicians make sure that they check for related disorders. The DSM-5 describes 19 major categories of disorders, each of which has several variations or types. We can see the 19 different types in this chart here from your book. These are the 19 categories that are within the DSM. This chart's on page 554. I'm not going through it, but you should, take a quick look through it, read it over. There's also cultural syndromes that exist that are specific, to certain cultures, but not others. So a cultural syndrome is a disorder heavily influenced by learning, context, or both, which is more likely to differ across cultures. The DSM-5 incorporates a greater consideration of cultural factors for each psychological disorder and reflects cross-cultural variations in how people exhibit symptoms. They give you a few examples here of disorders that are specific to certain cultures. I'm not going to pronounce any of these words, but you have the one from Japan, which is an intense fear of displeasing others. And that one from Haiti is a belief that mental health problems have been sent by one's enemies. And the third one there from Cambodia is a belief that a wind-like substance may rise in the body and cause various types of psychopathology. And these are disorders that exist within these cultures. And that will conclude learning objective 1.